human body is an organized society of cells. Each of them has a unique duty which nature has etched into our DNA. When a foreign body comes in contact with this society, the society reacts. Today, due to rapid modernization and increased industrialization, many new chemical compounds are in abundance, for which our system is not yet ready. So, when we come in contact with such adverse compounds, a painful reaction or allergy is inevitable.
I had been facing the problems with the dust mites, and I had been allergic to Bangalore weather conditions, and I had a sneezing issue, and I used to have great trouble in my daily routine because of these allergic conditions.
I am 15 years old and I have been suffering from asthma from when I was born. I was hospitalized when I was 10 because of the firecrackers and the smoke.
I had wheezing from the school days. Whenever during the winter season, it used to aggravate a lot.
There are many instances where an allergy has turned into a harmful disease like allergic conjunctivitis, allergic rhinitis, allergic bronchial asthma, urticaria, atopic dermatitis, or even angioneurotic edema that leads to anaphylaxis. The common allergens which induce allergy are house dust mites, insects like cockroaches, mosquitoes, moths, etc., pollens, molds, and occasionally food and drugs.
Early morning sneezing, running nose, itching eyes, these are all very common symptoms which a common man should recognize early for early intervention of allergy diseases.
It was in 1980 that Professor D.N. Shivpuri, Professor and Head of the Department of Medicine at the Patel Chest Institute, Delhi, inaugurated a specialty center for treating allergy disorders and named it the Bengaluru Allergy Centr. The Bengaluru Allergy Centr was started on a small premises in the central part of Bengaluru. Today, it operates from a spacious and fully equipped facility in the southern part of Bengaluru. The Bengaluru Allergy Centr is making all efforts to purify and standardize allergen extracts and deliver using superior technology. The Bengaluru Allergy Centr is one of its kind in India, treating thousands of patients suffering from various forms of allergy. The impeccable experience, expertise, understanding of the allergy and precise therapies have made the Bengaluru Allergy Centr a pioneer in the world of allergy treatment. The founder director and presently CEO of the Bengaluru Allergy Centr, Dr. Nagendra Prasad Komarla, has a vast and deep knowledge in the allergy field, making him one of the very few allergy experts in the world. An authority on allergy disorders, Dr. Nagendra Prasad is instrumental in making BAC the unquestioned leader in allergy therapies.
Sensitive individuals exposed to allergens induce allergy symptoms like allergic rhinitis, allergic bronchial asthma, urticaria, atopic dermatitis, or intestinal disorders. The reactions may happen within few seconds, or it may be a couple of hours, like 6 to 8 hours of contact of allergens. Most of the symptoms which is induced by allergies are controlled by the drugs which has been prescribed by allopathy, Ayurveda, homeopathy or Siddha. But as long as the drugs are used, the symptoms are well controlled. Once the drugs are stopped, the symptoms recurs. If the symptoms are recurring and it demands more and more drugs, from time to time the intensity of the drugs and dosage of the drugs has to be increased. Research in the field suggests to increase the tolerance of an individual by immunomodulation using the sensitive allergens which is responsible for allergy symptoms. In allergy individuals, reactive antibodies increases, whereas we had to reverse the reactive antibodies by producing more of blocking antibodies.
He is ably supported by the principal pharmacist, Dr. Paranjyoti, a name to be reckoned with in the pharmaceutical industry. An innovator par excellence, Dr. Paranjyoti heads the research and development and pharmacy departments at the Bengaluru Allergy Centr.
Bengaluru Allergy Centr has got an excellent facility now. right from sourcing of allergen inputs to the dispensing of the allergen products such as SLIT drops, SLIT tablets, SLIT stripes, moisturizing cream, and all other products that have been now introduced.
The treatments accorded to the patients are intensely researched and the techniques configured for excellent results. On arrival at the Bengaluru Allergy Centr, subjects are required to fill a patient's questionnaire while waiting to see the doctor and get ready for their clinical examination. Height, weight, blood pressure, and peak expiratory flow rate test are part of the clinical examination. Proficient doctors examine and, if necessary, refer for further tests. In case of suspected allergic rhinitis, the nasal smear test is done to identify the nature of inflammatory cells present. The mucus clearance test is done to know the status of nose block. For allergic bronchial asthma, the pulmonary function test, including pre- and post-nebulization, is done to measure the inspiratory and expiratory flow rate, lung capacity, including vital capacity, and to know the reversibility of the lung obstruction and status of restrictive lung. For follow-up, one has to appreciate the progressive status of reversibility of obstructive lung. In selective cases where the symptoms of allergy are questionable, a specific IgE screening test is conducted. If the results of the specific IgE test are positive, then the subjects are referred for an extensive specific IgE test. The extensive specific IgE test is conducted by using microplates consisting of microwells pre-coated with 210 allergens, inclusive of 70 aero and 140 food allergens. The extensive specific IgE test report is generated in the form of color graphs grading from class 3 to class 6. The specific IgE test helps to substantiate the findings of shortlisted specific IgE antigens. The selected allergens are subjected to SPT that is conducted as a gold standard to confirm the sensitivity of the allergens. A minuscule amount of allergens are introduced into a patient's skin by a metal lancet. On an average, 10 to 15 allergens are tested and the results recorded. The readings of SPT confirm the sensitive allergens. In the event of suspected urticaria, a small quantity of blood is drawn and serum separated. This serum is then injected intradermally to identify urticaria due to autoimmunity. A temperature test by using the temp test is conducted to identify the low and high temperature tolerance that is responsible for urticaria. The pressure test is to rule out pressure-induced urticaria. A personalized medicine prescription is generated with respect to the patient's clinical data, specific IgE and SPT reports, allergens shortlisted with details such as strength, dosage form of allergens, and duration in the form of SLIT prescription. This prescription under named patient's products would be forwarded to the dispensing pharmacy following good manufacturing practices or GMP for the preparation of customized SLIT. At the pharmacy, the allergens are first sourced, purified, and then characterized with in-house standardization. As a part of allergen extraction, the purified raw materials are defatted by the cold process. The extract is then subjected to clarification by a cooling centrifuge. The supernatant is a crude extract which is subjected to ultrafiltration or gel filtration to get a standardized extract. The extract is sterilized by cold filtration and is assayed for protein content, SDS page, and SPT to know the potency of the extract. This liquid extract is then lyophilized and stored. The prescription is processed either in the form of stripe or tablets. For SLIT stripes, the allergens are added to the polymer mix solution, cast on a glass plate, and dried. These dried films are then cut into small stripes and then packed after characterization and analysis. For SLIT tablets, the active allergens are mixed with diluents, disintegrating agents and flavors, mixed well using a granulator, and later dried. These dried granules are lubricated and compressed into tablets. The tablets are packed after characterization and analysis of content. Normally, the pharmacist counsels the subjects about SLIT and then initiate the first dose of SLIT. The preventer and reliever medications are dispensed with proper guidelines. They familiarize the subjects with the usage of prescribed throat sprays, nasal sprays, inhalers, moisturizing creams, preparation of nasal irrigation solution, proper administration of nasal irrigation, and so on. Doctors too counsel about the do's and don'ts and suggest effective usage of the medicines.
An in-house, that is our specialty, it is not an imported assay. An in-house enzyme immunoassay, which is primarily associated with the detection of these IgE molecules, is developed.
In a long-term management of allergy disorders, identification of the culprit of allergen is very much necessary. Once the sensitive allergen is identified, you can avoid that particular allergen so that the symptoms can be brought down to normal. But sometimes it is ineffective and needs a intensive treatment. The allergen-specific immunotherapy is prescribed in the form of injections, which is known as SCIT. And if it is in the form of oral, it is known as a SLIT. SCIT and SLIT are personalized medicine which is prescribed for a particular individual. Adherence to SLIT is more than SCIT. SLIT is friendlier. SLIT has to be used for 3 to 5 years, and SLIT prevents new sensitization and enhances tolerance.
Unlike the temporary relief by pharmacotherapy drugs that most allergy patients receive, BAC treats its patients for a permanent solution by personalized subcutaneous immunotherapy or SCIT. Starting from SLIT tablets, long-term management of the disorder has become the order of the day. Recently, sublingual immunotherapy or SLIT has shown better results as only purified and standardized allergens with optimum dose is administered. The Bengaluru Allergy Centr's research team introduced SLIT in the form of oral drops in the year 2003, biosublingual films in 2009, and SLIT tablets in 2013.
They have standardized the culturing technique. It is very good that now they have been able to come out the extracts of these mites in the form of tablets.
The level of clinical efficacy and adherence to treatment is very high with SLIT. SLIT plays a vital role at institutions where the practice of allergy treatment is robust. This is to generate more clinical benefit with evidence-based medicine and to recognize the allergy diseases.
Yeah, starting I had been given drops, 5 drops a day I had to take every day. That happened for almost 2 years, and then it came to SLIT. That also for another 1.5 years, and then came the tablets. Tablets are most easiest to take.
I'm so happy to take this treatment, which was so easy to consume the medicines, and also it was not disturbing any of my daily routine.
I've been taking the strip tablet and also the fluorocot, and the nasal irrigation as well. And with that, I have improved considerably. I have been able to participate in sports and other activities in school, and I no longer wheeze during the valley or any such other problems.
I continued from all the way 2006 till 2011, and now I'm allergy free. So I feel that this EIA SLIT medicine is very, very effective.
This is really a great treatment which doesn't have any side effects, which simply helps you to improve your immunity, and it is a permanent solution to your allergies.
Now I can live peacefully, I can breathe peacefully.
Thousands of patients' medical records demonstrate that SLIT counters allergy better and reduces the intensity of allergy symptoms faster and permanently without recurrence. The fact that the allergy symptoms fade out over a period of time has made SLIT command more respect among patients.
ಕ್ರಮೇಣ ಅದರಲ್ಲಿ ಇಮ್ಯುನೋಥೆರಪಿಲಿ ಹೊರಗಿಂದ ಬರ್ತಾ ಇದ್ದ ವಸ್ತುಗಳು ನಮ್ಮಲ್ಲೇ ತಯಾರು ಮಾಡ್ಕೊಳ್ಳೋಕ್ಕೆ ಶುರು ಮಾಡಿದ್ವಿ. ಯಾಕಂದರೆ ಕಾಸ್ಟ್ ವೈಸ್ ಜನರಿಗೆ ಹೆಲ್ಪ್ ಆಗಲಿ ಅಂತಂದು ಕಡಿಮೆ ಕಾಸ್ಟ್ಗೆ ಕೊಡಬೇಕು ಅಂತ ಹೇಳಿ, ಮತ್ತು ಅದು ಲೈಫು ಚೆನ್ನಾಗಿರಬೇಕು ಅಂತ ಹೇಳಿ.
The infrastructure and the equipment at the Bengaluru Allergy Centr are world class. Patient comfort and hygiene maintenance are of utmost priority. Carefully selected, well-trained and well-groomed technical staff are putting the patient's needs before their own. Experts from across the globe are a part of the highly proficient human resource at the Bengaluru Allergy Centr.
And I'm amazed and impressed with Dr. Prasad and his associate Dr. Paranjyoti's work in this allergy field. They have improvised basic SLIT therapy to suit the Indian conditions. Dr. Prasad certainly has reached a new higher level in his clinical practice and has become a leading allergist.
We used to do monitoring of airborne pollen every day and consolidate the results in a week. So weekly reports we used to give, and that was very useful for allergy specialists.
We have adopting the internationally accredited system that is called a Nordic system, and each hour the quality control also been in place. Particularly each extract has been subjected to electrophoresis and ELISA testing. So usually because we are going to confirm, okay, this is the allergy, these allergens are present.
The backbone of the Bengaluru Allergy Centr has been its tremendous research capability. BAC doctors and professionals have presented several research papers at national and international seminars and have published articles in various journals.
Laser sprays, inhalers and all that were very clearly and very scientifically were taken up for study. So this center, I feel, has done a great job.
BAC has several patents credited to its name. It is working closely with several universities and leading scientists across the globe.
We have been having a strong collaboration with Bengaluru Allergy Centr. Right now we are working on a novel technology called as microneedle technology. Microneedle technology is basically consisted of micron-sized needles in the form of an array, which would perturb the stratum corneum barrier, the skin barrier, and improve the delivery of vaccines. These needles would not penetrate far enough down to touch the neurons present in the dermal region. So that's why it would be a pain-free delivery technology. Our collaboration with Bengaluru Allergy Centr has been very productive, and we hope that in coming days our research will lead to some novel findings which would translate into clinical practice and help the people suffering with different kinds of allergies.
The Bengaluru Allergy Centr has conducted several health awareness camps and allergy awareness workshops in its efforts to reach out to society.
I see the doctor taking initiative in everything. I mean, I can be very sure that okay, this will go good.
Bengaluru Allergy Centr started like just any other medical place where it is just a treatment. You come in, meet the doctor, he gives you a prescription, you go out, fill it and take the medicine. But right now you come in, you meet the doctor, you know what is happening, your tests are being done over here, so we do not depend on external bodies, and we do not have to face if their devices are right or wrong. We do the tests ourselves.
The work accomplished by the Bengaluru Allergy Centr could be termed as magnificent and highly significant, while the value added by BAC in treating allergies of all kinds is innumerable. The amount of work still to be done is infinite.
Our vision is to reduce the allergy symptoms in a subject and bring back to normal life, so that the capacities of individual efficiency can be maintained to a normal extent. Learning capacity among the students will be maintained, and earning capacity by earners is maintained to the optimum what they are capable of. Our motto is to manage allergy by SLIT and enhanced quality of life.
The Bengaluru Allergy Centr is marching ahead to complete its mission to further purify and standardize allergen and deliver by SLIT and epicutaneous immunotherapy or EPIT. The Bengaluru Allergy Centr provides total relief from allergy symptoms to every suffering patient and make the world allergy tolerant.